New this evening, a nationwide crackdown on what the feds are calling massive healthcare fraud. The Justice Department says it has charged more than 300 people in fraud amounting to more than $14 billion. At least.
Thank you all for joining us today as we announce the largest coordinated healthcare fraud takedown in the history of the Department of Justice.
All right, back to that top story. Tonight, a dozen Indiana medical workers face charges in what the Department of Justice calls the largest healthcare fraud takedown in history.
These criminals didn't just steal someone else's money. They stole from you.
It begins with a number so absurd, it almost sounds like fiction. 14.6 billion. That's not a lottery jackpot, not the GDP of a small nation. It's the largest healthcare fraud bust in U.S. history. And behind it wasn't just a few shady doctors or corrupt billing clerks, but an international criminal syndicate that reached from the corridors of American hospitals to secretive offices in Moscow, Estonia, and Kazakhstan. In June 2025, the U.S. Justice Department dropped the hammer. 324 people charged across 50 federal districts. Agents seized over $245 million in cash, luxury cars, gold bars, cryptocurrency wallets, even entire mansions. And this wasn't some petty insurance scam. This was industrial-scale theft, an operation so vast it could have destabilized one of the country's most critical safety nets, Medicare. The Attorney General called it the largest coordinated healthcare fraud effort in American history. And she wasn't exaggerating.
When we opened the books, what we found was staggering. This wasn't sloppy fraud. This was organized, calculated, and relentless.
They told us, don't ask questions, just process the claims. But we knew something wasn't right.
To put $10 billion in perspective, that's more than the annual budget of some entire hospitals.
The heart of this case had a name ripped from a Hollywood heist movie, Operation Gold Rush, a $10.6 billion plot to bleed Medicare dry. The plan? Genius in its simplicity, diabolical in its execution. First, the syndicate, run from Russia, Estonia, and Kazakhstan, quietly bought legitimate U.S. medical supply companies. On paper, nothing suspicious. In reality, those new owners were just straw figures masking the real masterminds. Then, they started submitting Medicare claims. Not for the occasional wheelchair or oxygen tank, but for urinary catheters. Millions of them. Here's the kicker. They billed for more than 1 billion catheters in less than a year. One investigator said, "I don't even know if the U.S. can manufacture 1 billion catheters that fast." Spoiler, it can't. And these weren't shipped to patients. Most didn't even know they'd been prescribed anything until they got a bill. It was the criminals' greed that betrayed them. Medicare's data systems flagged the sheer absurdity of the numbers. Nearly $4.45 billion in fraudulent payments were queued up, but over 99% were stopped before they left the Treasury. Only $41 million slipped through. 19 people have been charged in connection with Gold Rush. Some were caught in Estonia, others at U.S. airports as they tried to flee. Their money trail zigzagged through cryptocurrency exchanges, shell corporations, and bank accounts spread across continents.
Why Medicare fraud? Like, why was that alluring to you as compared to other ways, maybe even illicit ways to make money?
It's easy.
Did someone teach you how to game the system?
A friend of mine, yeah, he teach me. One day he called me and says, "Look, I do this.
Are there a lot of people who are willing to break the law?
A lot of people. You'll be surprised for money. They'll do anything.
Is there a lot of money to be made?
A lot of money. Millions of dollars they make.
How much?
Millions of dollars.
Some frauds are about money, others about human cruelty. In Arizona, investigators uncovered one of the most disturbing schemes in recent memory. A group of defendants, including 5 licensed medical professionals, were performing medically unnecessary skin grafts on terminally ill patients. People who should have been spending their last days in peace and dignity were instead used as billing codes. Many patients died the same day the grafts were applied. The ringleaders, Alexandra Gerke and Jeffrey King, allegedly lived in a $6 million mansion, drove luxury cars, and hoarded $500,000 worth of gold bars and jewelry. When arrested at Phoenix Airport, they were boarding a flight to London, carrying 2 books: How to Disappear, Erase Your Digital Footprint, and Criminal Law Handbook, Know Your Rights. They had billed Medicare for roughly $1.2 billion, and the people they targeted weren't just seniors in hospice. They included disabled Americans and nursing home residents. As one DOJ official said, "These criminals didn't just steal money, they stole from you." This takedown also revealed another ugly truth. The opioid crisis isn't just fueled by back alley dealers. Some of its biggest suppliers wear white coats. 74 defendants, including doctors, were charged with illegally distributing over 15 million prescription opioid pills. The cases ranged from pill mills disguised as pain clinics to physicians who prescribed dangerous drug combinations in exchange for sex. One Tennessee doctor, nicknamed Rock Doc, allegedly handed out fentanyl and oxycodone like candy. In Kentucky, another left signed blank prescriptions for staff to fill in for patients he never met. In Ohio, a clinic allegedly dispensed 1.75 million pills in just 2 years. The DOJ's description was blunt: white-coated drug dealers. Healthcare fraud has gone digital. 49 defendants were charged in scams involving $1.17 billion in fraudulent Medicare claims through telemedicine and genetic testing. The playbook is chillingly modern. Step 1. Use cold calls or online ads to offer free genetic testing. Step 2. Harvest Medicare beneficiary data. Step 3. Use AI to generate fake patient consent recordings. Step 4. Pay licensed providers to approve the orders. Step 5. Bill Medicare for tests and equipment never needed, and often never delivered. In one case, a telemedicine company owner allegedly pulled in $46 million through misleading calls, fake consent, and phantom shipments. This wasn't just an American problem. The masterminds of Operation Gold Rush never had to set foot in the United States to steal billions from it. These were transnational crime syndicates with hubs in Russia, Eastern Europe, and South Asia. They used foreign shell companies to buy U.S. medical suppliers, laundered money through crypto, and coordinated across borders in real time. As one federal prosecutor put it, they are stealing from American taxpayers from halfway around the world. The global nature of the scheme is a nightmare for law enforcement. Arrest warrants mean little when suspects are in countries with no extradition agreements. And yet, the DOJ managed to catch several at airports and even extradite some from Estonia. This case forced the U.S. to rethink how it fights healthcare fraud. Enter the Healthcare Fraud Data Fusion Center, a new command hub using AI, cloud computing, and interagency data sharing to spot suspicious patterns before the money leaves the government's hands. Attorney General Pam Bondi called healthcare fraud a moral attack on America's most vulnerable. Dr. Mehmet Oz, yes, that doctor, Oz, now head of Medicare and Medicaid, quoted Hubert Humphrey, "The moral test of government is how it treats those at the dawn of life and those at the twilight of life." This was more than a bust. It was a warning. Medicare will no longer be an ATM for global crime rings. The cat and mouse game between fraudsters and investigators has gone digital. Criminals now use advanced analytics to identify weak spots in Medicare's system. They hide behind crypto wallets and create fake corporate histories for shell companies. But the government is adapting. In Operation Gold Rush, Medicare blocked over 99% of fraudulent claims before payment. Big data saved more than $4 billion, money that would have been gone forever just a few years ago. The message is clear. Technology can be used to deceive, but also to defend. Every fraudulent claim is more than stolen money. It's a threat to the healthcare lifeline for millions of seniors and people with disabilities. It inflates costs, erodes trust, and risks pushing the system toward collapse. But this bust also proved that aggressive enforcement works. The DOJ didn't just recover $245 million in assets. It sent a message to fraudsters everywhere. The easy days are over. The $14.6 billion takedown is already being called a turning point. More rigorous background checks are being put in place for anyone applying to bill Medicare. AI fraud detection is getting faster and more accurate. and cooperation between U.S. agencies and foreign governments is expanding. Yet the fight is far from over. Criminals will keep innovating, testing new schemes, exploiting every gap. But now, they know they're being hunted. Because this isn't just about money, it's about the moral contract between a nation and its most vulnerable citizens. And in 2025, that contract was almost shattered until the government decided to fight back harder than ever before.